Bismillah, wassalatu wassalamu ala Rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh. A very warm welcome to the inaugural first session of the Health Expert Talks series. And after thanking Allah subhanahu wa ta'ala for giving us the platform and the tawfiq to launch this, I need to thank all the organizing brothers from the masjid, the management brothers, Imam Suhaib, Ishfaq Bhai, Dr. Saeed, Dr. Azhar, Sadiq Bhai, and all the other brothers who've kindly given ideas and given encouragement to launch this. So, introducing this series, so this is a series of health education events and to benefit the health and well-being of our community. So, one session every month on the third Sunday of the month, and every month there will be a different topic. Each topic will be led by an expert in the field, and then following that there will be open question and answers for anything of relevance to that topic. And why are we launching this initiative? So the reason is that Muslims have worse health than other communities in the UK. So that is something that's proven. So for the rates of things like obesity, diabetes, high blood pressure, heart disease, stroke, depression, years of poor health, years of disability are all worse for Muslims in the UK than any other community. Even other South Asian non-Muslim communities like the Hindu community or the Sikh community, Muslims have the worst rates for all of these things. So this is something that we should be trying to address. It's important that we try to address this. So this is the first session, but inshallah many sessions will follow, and may Allah make each session more successful than the one that was preceding it. And obviously we really need the support of the community. So we need the support of the community to engage with the sessions, to apply what they learn in their own lives, in their own families, in their households, and to spread what they learn amongst family, friends, neighbors in the community, and to also encourage and invite other members of the community to attend the sessions. And just as importantly, we need your feedback, we need your thoughts, your ideas about what topics should be covered, about different types of sessions. So this is one type of session that we could do, this is one type of activity, but there could be many other types of activities, and we need your ideas and thoughts, and also your participation and your time and effort as well is very welcome, and we humbly request that you help setting up any activities that might benefit the community. And just as importantly, what we must aim for is then to extend this to other communities. I don't think that we shouldn't be is keeping this to ourselves. If we have some skills, if we have some information, some abilities that we can use to benefit the Muslim community, we also should be taking this out to the non-Muslim community and going to their places, going to their spaces, and sharing our information, our abilities with them, inshallah. So after the talk is done, inshallah, we will share a feedback form on the WhatsApp group, and I'll be very grateful if you could complete the feedback. If you're not part of the WhatsApp group, then there's a QR code on the notice board there. If you could scan that, then you can join the WhatsApp group, and then inshallah the feedback form will be shared on that. Okay, so now coming to the topic for today. The topic for today is brain health, preventing and treating brain diseases. First, what's the idea of preventing brain diseases? Why is it important? It's important to try and prevent brain diseases, to maintain our memories and our mobility as much as possible for as long as possible, because our ability to function, to contribute in our own lives and in the lives of our families and in our community depends so much on our memories and our mobility. And these are things that get affected as we grow older. So we're going to discuss some strategies in trying to preserve those things, trying to preserve our memories and our mobility to the best, as best as possible. And then we'll also be discussing some of the commonest brain diseases, and we will be talking about the latest treatments for them. And the reason for that is that I've seen that sometimes people are suffering in silence. So they are unfortunately suffering from a particular brain disease, migraine, Parkinson's disease, other diseases, and they're not well controlled, and they don't really realize that there might be help out there, that there might be other treatment options which could improve the quality of life. So I'm going to talk about some of the latest treatments that, inshallah, will be of benefit to people who are experiencing these diseases. And these are common diseases, and you will undoubtedly have friends, families, colleagues, neighbors who will have one or more of these diagnoses. So please do share with people who might benefit from this. So why am I talking about brain health? Because I'm a consultant neurologist. So just a brief introduction to me. So I was born in Lahore. So that masjid on the left is the illustration of the famous Badshahi Masjid in Lahore, beautiful masjid. And but just before university, I came to the UK and I did my medical degree from King's College in London. And then soon after that, I moved to Liverpool. Liverpool has one of the biggest neurosciences hospitals in the UK, or in fact in Europe. So I moved to Liverpool. I did my PhD from there, and for almost 2 decades now, I've been in Liverpool at the Walton Centre, and I still work there, although I now live in Blackburn. So why does brain health matter? So we live in an aging population. So by the middle of this century, 1 in 4 of the UK population will be 65 years or older, and many of the most important brain diseases become more common as we go older, like dementia, like Parkinson's disease. But the important point is that these diseases are potentially preventable. So if we make the right interventions in earlier parts of our life, then we can prevent or delay these diseases from occurring and the impact that they would have on our lives and the lives of our families. So it's really important to be aware of what can be done to try and prevent or delay these diseases. And of course, the brain health directly impacts our independence, our relationships, how we can contribute as individuals, to families, to communities, to neighborhoods, and to society. And these are some key messages which are going to come again and again. These are some key points, key interventions which are important for a number of brain diseases. So the first is physical exercise. So what we tend to say is 30 minutes of exercise 5 days a week. So 30 minutes of exercise 5 days a week really improves your brain health and reduces the risk of a number of brain diseases and other diseases. At the same time as engaging in physical exercise, we need to be engaging in mental exercise and mental stimulation. So this could be something as simple as puzzles or learning new skills or learning new hobbies. And the key here is that you want to push yourself. You want to push your mental abilities. You want to push yourself just beyond your comfort zone. So you don't want to keep doing the same thing that you always do, the same puzzles that you always do and you can do without even thinking about it. What you want to do is to put some strain, some pressure, a degree of strain and pressure on your mind, and you want to engage in activities like that. The next point is social connection. This is extremely, extremely important. It's such a loneliness is such a huge problem in the modern Western society, and we as Muslims living in the society are also undoubtedly affected by this. And loneliness significantly increases dementia risk. And what we need to do is, for our own benefit and the benefit of others in the community, we really need to maintain those social connections. And this is, of course, what our religion teaches anyway, maintaining social connections with families, with relatives, and in the community. And this is something that is really, really important for brain health as well. And the last thing is a nutritious diet. Again, this is an area which we really need to focus on as a community. So what's diets like the Mediterranean diet, and we'll speak more about this, can reduce cognitive decline, memory decline, reduce the risk of dementia. So diet is something that is we really need to focus on a lot in our community. So probably the most important disease that we need to think about is stroke. So strokes are that stroke will be the most common neurological disease that affects people in the UK, and stroke is preventable. So 90% of stroke cases are preventable with lifestyle changes. So we will all know people who have unfortunately had a stroke, and you will know what devastating impact that can have on people and for the rest of their lives and on their families. So it is really important that we do put in place these behavioral changes to prevent suffering from a stroke. From this slide, the most important point is blood pressure. Blood pressure is the single most important risk factor for stroke. So the key message here from this slide is get your blood pressure checked. Get your blood pressure checked. In our community, even and outside our community as well, but unfortunately, particularly in our community, even young people can suffer from high blood pressure. So get your blood pressure checked. If it is found to be high, take it seriously. If there are obviously dietary things that you can do, reducing your salt intake, etc. But if medications are prescribed, then take them regularly and have regular blood pressure checks. Other things which increase the risk of stroke include diabetes, which again is obviously very high in our community, and it's important to take all these steps, dietary steps, exercise, medication, and regular monitoring to keep the diabetes under good control. Again, as mentioned before, staying active is hugely important. That 30 minutes of exercise 5 times a week is hugely important in reducing stroke risk as well. And finally, quitting smoking. So smoking really pushes up the risk of stroke and also heart attack. But the good news is that once somebody stops smoking, the risk starts coming down pretty quickly. So it's never too late. You mustn't think, well, yeah, I've smoked all of my life and what's the point of quitting now? It's never too late. Whatever your age, regardless of how long you've been smoking for, do stop smoking. And obviously there's so much help available now in doing so. So your GP and even your pharmacist, you don't have to make an appointment, just walk into the local chemist and they can help you with strategies to quit smoking. It's worth just revising this, going over this, the fast mnemonic for recognizing a stroke. We've all seen this on TV and other places in the ads. So how do we recognize that somebody might be having a stroke? If their face starts to droop, you ask them to lift their arms up, but they can't keep one arm up. One arm keeps drifting down. If their speech is getting slurred, or maybe they can't find the right words, they can't get the word out, then those are all signs of a stroke. And what you need to do is to call 999 without delay. What we say is time is brain. Time is brain. The longer we wait, the more brain that person is going to lose. So we need to act without delay. So now we're going to talk a bit about memory, aging and memory. So obviously as we all grow older, memory starts to get affected. That's only natural to see that. So what's normal? So things that are normal are that forgetting where you put the keys. That happens to all of us, right? Looking in the pockets, forgot where you put it. It takes half a minute, but then you find it. That's pretty normal. That doesn't mean you've got dementia. Don't worry about that. Taking a bit longer to learn something new, get your head around a new phone, learning how to use a new app. Obviously, as you go older, that's to be expected. Reaction times being a bit slower, that's quite normal. Becomes more difficult to do a couple of things at the same time. Multitasking, men are not good at multitasking anyway, right? But I think maybe the sisters will notice that more. And forgetting somebody, or taking a few seconds to remember somebody's name. Oh, I've seen this person. The name is on the tip of my tongue. Oh yeah, then it comes back to you. That's all quite normal. What's not normal is getting lost in familiar places. So, for example, you've been walking to this masjid for 20 years. You always come out the house, walk down, turn right, turn left, and found your way to the masjid without even thinking about it. But one day, you get lost. You walk into the masjid, you've done it countless times, but one day you get lost. That shouldn't happen. And that's can be one of the very early signs that there's a memory disease, there's a disease affecting the memory. Difficulty managing finances. You always managed your money, your bills on your app or whatever, however you do it. Never had a problem, never forgot to pay bills, never had any issues with managing your bank account, but all of a sudden it becomes too much. You just can't handle it. It's too much for you to take in, too much for you to handle. Another sign is repeating questions frequently. So, where are we going today? Your spouse tells you. Half an hour later, so where are we going today? And the spouse tells you again. And half an hour later, I think we're going somewhere today, right? Where are we going? And, so that is, that's something that is a bit of a sign that there might be a memory disease. Changes in personality or judgment, getting persistently snappy, just change in personality, getting persistently irritable. Okay, we can all get irritable every now and then, but if it becomes a persistent problem every day, and it just seems that your personality is not the same. It's not that something's annoyed you and you became a bit irritable for a few minutes. It's that your personality has changed, and this is what your personality is like now. So that can be a sign. And withdrawal from social activities, becoming more isolated, not wanting to talk to people, not wanting to engage in the activities that you used to engage with, perhaps because they're becoming just too difficult. Because of the memory changes, they're becoming too difficult, and the person is trying to withdraw from them. So that can be another sign. If any of these signs are seen, then it's important to see your doctor and get that assessed. So what is dementia? So dementia isn't a single disease. There are many different types of dementia. So, for example, there's vascular dementia, mixed dementia, many different types. But the most common type is Alzheimer's disease. That's a type of dementia, but that is the most common type, accounting for 60 to 80% of cases. Over the age of 85, 1 in 5 people have Alzheimer's disease. So it does become more and more common as we grow older. There's no cure yet, but again, the kind of lifestyle interventions we mentioned before can prevent it or delay it. So again, it's the same things that we mentioned before: staying physically active, challenging your mind, learning new skills, again, pushing your mental abilities just beyond the comfort zone, maintaining social ties, staying connected, coming to the masjid, engaging in social activities, speaking to your friends and family on the phone, visiting them in their houses, extremely important, and managing those health conditions that we mentioned: diabetes, high blood pressure, and also depression. Okay, so we're coming back to the diet. So because as we were saying, diet is something that we really need to focus on as a community. So there's a type of diet called the MIND diet. It's similar to the Mediterranean diet, but it's a bit more than that. It's a Mediterranean diet plus. So it's a bit more than the Mediterranean diet. So, you wouldn't be able to make a list of all of these things now, but if you just Google MIND diet when you get home, you'll obviously get all the information. MIND diet is proven to reduce the risk of Alzheimer's disease and dementia. So it's really, really important that we try to adopt as many of these eating habits as we can. So there's foods that it encourages you to eat, and foods that it encourages you to avoid. So what we want to eat more of is green leafy vegetables, berries, nuts. You use olive oil for all of your cooking. Use that as the main cooking oil. Whole grains, fish, beans, and poultry. The things that it tells us to reduce or avoid are red meat, butter, cheese, pastries, and sweets, and fried food or fast food. So if you look at this slide and if you reflect on it, I think we will all admit that the improvements, there's room for improvement for all of us. And this is well worth doing. This kind of diet will not only reduce the risk of dementia and Alzheimer's disease, but it will improve your heart health and other types of health as well. So this is a bit of a image showing the kind of foods that we should be eating more of and the kinds of food that we should be eating less of, just to help us visualize this a bit more. Again, it's a very, very important intervention for us to make. Another risk factor for dementia, sometimes not fully appreciated as much as it should be, is hearing loss. So severe hearing loss increases the risk of dementia by 70%. So hearing loss, poor hearing, can have a really, really big negative impact on mental abilities. So it's really important to address this. I think there's a stigma and a taboo around this, certainly in our communities. People don't like wearing hearing aids. People don't like admitting that they might be hearing problem. But it's really important to address this to reduce the risk of dementia. So the message is, if there's any signs of hearing declining, then getting hearing checks regularly. If hearing aids are offered, then to take up that offer, to use the hearing aids. And finally, to stay socially engaged, because something that happens very, very commonly is that when people start developing hearing problems, they disengage socially. So it's too difficult to then be engaging in conversation. You have to keep asking people, what did you say? What did you say? And what the natural reaction is that people just disengage. That shouldn't be done. So even if it's hard to interact socially, people must keep on trying to do that. Because otherwise it'll be a vicious circle, because that social disengagement is an independent risk factor for dementia. Another lifestyle factor that we often neglect is sleep. The quantity of sleep and the quality of sleep, again, really, really important for maintaining good brain health, for firming up our memory, for removing the waste from the brain, for restoring the brain. Good quantity and quality of sleep is really, really important. And we should be aiming for about 7 to 9 hours within a 24-hour period. So some of the things that we need to think about in trying to get good quality sleep are shown in this slide. So the one thing is trying to maintain a consistent schedule. Okay, for Muslims, that can be challenging because the prayer times change so much through the year, but still trying to maintain a consistent schedule as much as possible. Another factor is optimizing your sleep environment. So making sure your bedroom is comfortable, is dark, quiet, maybe blackout blinds or a white noise machine, just to make sure your sleep is as good as it can be. Creating a relaxed bedtime routine, so half an hour before bedtime, just winding down, maybe reading something relaxing, gentle stretching, avoiding any vigorous exercise. You can do obviously exercise earlier in the day, but not an hour before bedtime. And things like limiting caffeine intake just before bed, or having heavy meals just before bed. Related to this, another condition which is often overlooked but can have a big impact on memory and mental abilities is obstructive sleep apnea. So this is a condition in which people have difficulty breathing when they are asleep. So some of the signs of this are loud snoring. So the spouse might say that the person snores really loudly, but then it's while they're sleeping, they seem to stop breathing. So they gasp and stop breathing. So they're snoring loudly, and then they seem to stop, and then start snoring away again. So that can be a sign of this condition. And other things that you might see during the daytime is daytime sleepiness, because they're not actually getting relaxing sleep through the night, because sleep is just getting interrupted throughout because they stop breathing. So the sleep is getting interrupted throughout the night. So they're not getting good quality sleep. So then they are sleepy during the day and they're falling asleep and they're having to take naps, and they can also get headaches. So this, again, if older people get headaches, this is something that's often overlooked, digressing a little bit. But when they come to our neurology clinics, older people with headaches, this is something that we always, we should always explore, whether they might have obstructive sleep apnea. I think even neurologists fail to pick up on this. And this can have a huge impact on your alertness the next day. If you're obviously falling asleep, how are you going to be alert, and your mental abilities. So what's important is to recognize the signs, which we just discussed, to go to the doctor, is easily diagnosed and is easily treated. And that's one of the reasons why it's important, because it's relatively easy to do something about it and get rid of it. And the life quality benefits can be huge when this is treated. So this is one not to be missed. And depression. So depression really increases the risk of dementia. This is something, again, there's some stigma attached around this in our community. It's a bit of a taboo for various reasons, but it's something that we really need to confront and really need to get our heads around and to deal with. So dementia can have a huge impact on mental abilities. And in fact, there's a condition called pseudodementia of depression, which basically means that sometimes people are so depressed that it looks like they got dementia. So they don't actually have dementia, don't have dementia at all, but they're so depressed that it looks like they have dementia. And of course, dementia is not treatable, but depression is treatable. And so we've seen people who look, like they've got severe dementia, they can't do anything, they're not really engaging in anything. And when we realize that actually it's not dementia they've got depression, you treat the depression and they're back to normal in terms of their mental ability. So this is again a hugely important factor that we really have to deal with. So it's important that we recognize the signs. If there's this persistent sadness, obviously we all have ups and downs, we can all be sad sometimes, but this persistent sadness, loss of interest in activities, tiredness, not being able to sleep, waking up early in the mornings, then these can be signs of depression. And it's important to encourage people to seek help, to see their GP. This is something that can be easily addressed, so this shouldn't be ignored. And again, coming back to those social connections, it's really important that we combat isolation, we combat loneliness. That is, again, one of the underlying factors for depression, and that's something that we really do need to address. Another really important point, especially as we grow older, is balance. Obviously, as we grow older, balance or declines. That's completely natural. But what we see is, as we grow older, people tend to have more and more falls, and that can have a huge impact on people's quality of life and their well-being. People fall, they lose their confidence in walking, and then it becomes a vicious circle. They walk less and less, and then they get deconditioned. They're able to walk less and less, and it just becomes a vicious circle. If people fall and break a bone, fracture a bone, then that has a huge impact. Fracturing a bone, ending up in hospital, can really, again, these deconditionings, losing muscle, losing strength, can have a huge impact of that nature. And so it's really important, as much as possible, in amongst our families, as we growing older, as the elder members of our family are growing older, that we do everything we can to maintain balance and prevent falls. So this includes strength training for older individuals. These can be sitting exercises, chair exercises, getting regular eye checks, because obviously if your vision is poor, you can't see obstacles in your way, and you could fall. Getting medication reviews. So many medications can cause dizziness, and so it's important to get your medication reviewed. It may be that those medications are causing you dizziness, but they're not actually needed anymore. So perhaps those can be discontinued. And making sure that the home environment is safe, removing any clutter around the house, making sure there are no loose carpets, and maybe installing handle grab bars if required. Okay, so just to summarize the key points from this preceding slides. So number one, follow the mind diet. So look up the mind diet when you go home, and try to implement as much as of that as possible in your home. Try to slowly, gradually increase how much you're following that diet in your home, and that can have a really positive impact. Number two, staying active. Do whatever you can, and slowly increase that as much as you can, and that's a very important step to take. The number three, social connection, maintaining those connections with family and with relatives, maybe volunteering and joining activities in the masjid, in clubs, etc., maintaining those social connections. And lastly, learning something new. Again, as we said before, just challenging your mind, exercising your mind, stepping outside your comfort zone when you're learning something new. Okay, so that was everything to do with prevention, and just briefly going to touch on some common diseases and the newest treatments for them. So firstly, migraine. So migraine is one of the most common brain diseases, and many of you will suffer from migraines. Many of you will have family and friends who experience migraines. A recent and very important development in migraine treatment has been the development of these medications. They're called anti-CGRP medications, and the different ones within this family. So there are three listed. The top two are tablets. The bottom one is an injection that the patient injects themselves. This has really transformed the treatment for migraine, the treatment for difficult migraine. This has really transformed this. These are actually the first treatments which have been made specifically for migraine headaches. And we see many people who were really disabled by severe, frequent migraine, had really poor quality of life, and after suffering like that for decades, we've started them on medications like this, and their life has been completely transformed. So, if people don't tend to know about these, if you suffer from severe migraines, frequent migraines, or you have family or friends, just keep this in mind. You go and speak to a GP about this. Typically, the GP will have to refer to a neurologist to get their agreement to start this. I think that's the case in this region, isn't it? That it has to be consultant initiated or suggested, recommended. So it has to be consultant recommended. But it's something just very important to keep in mind for people who are sufferers from severe migraine. Now coming to tremor, the most common type of tremor is something called essential tremor. Essential tremor. So it tends, if people hold their hands out, and the hand tends to shake. It tends to be in both hands, and it can really interfere with daily activities. Just having a cup of tea, or using a screwdriver, or using a phone. And this has traditionally been treated with different types of tablets, which are not always effective. But a relatively new development in this is using ultrasound, focused ultrasound. So in this, ultrasound waves are used to target that part of the brain where the tremors start from, and it doesn't involve any cuts to the skin. It just ultrasounds are projected to that part of the brain externally, and this can often have immediate results. So as soon as they have the treatment, the tremor is much better. So again, this is a really important treatment for those with essential tremor, which is interfering with their life and has not responded to treatment. So in this region, the only hospital offering this is Liverpool. the Bolton Center. So, but you know, if you know somebody who has this, you can just go to the GP, and the GP can send a referral to Liverpool. Go on. That's something that's something different. So functional neurological disorder, that can include tremor, but that is different from essential tremor. Probably if I could repeat your question on the mic. So the brother said, asked about functional neurological disorder, FND, functional neurological disorder, and asked whether essential tremor has something to do with it. So that's different conditions. Those are two very different conditions. But tremor can be a part of FND. FND can have many symptoms. Tremor can be a part of FND, but it's not essential tremor. And ultrasound, focused ultrasound, unfortunately, would not be a treatment for FND tremor. But we can maybe perhaps talk a bit more about FND at the end of the talk. Please feel free to ask any other questions. So again, so just something to keep in mind, and let friends and family know. So coming now to Parkinson's disease, again, very common in the community and becomes more common as we go older. The main signs of these are tremor, stiffness in the limbs, gait difficulties, loss of balance, and this is treated with medications, physiotherapy or occupational therapy, speech therapy if needed, to try and maintain function as much as possible. And for this, there have been a couple of recent, or relatively recent, treatment developments that I would like to mention in case you have family or friends who have Parkinson's disease and it's not well controlled on medication. So there is deep brain stimulation, where electrodes are implanted into the brain, into the part of the brain which controls movement, and it sends a gentle electrical current which helps the symptoms. So this isn't particularly new, but people are often not aware of this. This is something that people should be aware of. If somebody is going to get this, they have to really get this before they get too old. So this is something you don't want to miss the window. If somebody's having difficulty having symptoms controlled with medication, that this should be considered sooner rather than later, because it is brain surgery, and if people become too old or frail, then they're not fit enough to have the procedure. So there is a window where this should be considered. So it's important to keep this in mind. And again, if you think you have any family or friends in the situation, they should just visit your GP, and the GP can refer to the Bolton Center to consider this. Another quite new treatment is Produodopa. This is an infusion. So this needle goes into the skin, and the pump infuses the medication continuously under the skin, and this allows for more steady levels of medication throughout the day. Again, for patients who are having difficulty getting the symptoms controlled with tablets, this is quite a new option, and again, something to keep in mind. If people are in this situation, they should ask for a referral to the Movement Disorder Clinic, Parkinson's Disease Clinic, to consider this option. So I just wanted to mention these new treatments for Alzheimer's disease. You might have heard about these in the news, and so these two medications, the names shown on the slide. So you might have heard about them, but I don't think you would have come across anybody using them. And so the reason for this is that, so what's positive about these medications is that they are actually the first medications which target the harmful proteins that actually cause Alzheimer's disease. Up to now, all the other treatments that we've had for Alzheimer's disease control the symptoms. They don't target the actual proteins which affect the brain and cause Parkinson's disease. So these are the first medications to do that. So there's been some excitement around them, but there are some challenges associated with them. So you have to have a special brain scan before the treatment can be started. This doesn't cure the disease. It's only proven to work for early stages of Alzheimer's. It's given intravenously through a drip, so requires regular hospital visits and requires regular scans over the course of the treatment to look for any brain swelling or any small bleeds. But because of all of these challenges, what's happened is that the UK government agency, which assesses for safety and effectiveness, they've approved it, so they've said it is safe and it's effective. But the government body, which assesses whether it's value for money, has said no. So what this means is that it's licensed in the UK, it's approved in the UK, patients in the UK can have it, but not on the NHS. So in some private hospitals, in fact, even most private hospitals won't offer this, but in some private hospitals, for example, in London, these are available privately, but not yet on the NHS, but things might change in the future. And finally, coming to epilepsy, another very common condition. Many people in our community have epilepsy. So epilepsy, as you know, is traditionally controlled by using tablets, using medications. But if there are people who have severe epilepsy which is not controlled by medication, then surgery can be considered in the appropriate cases. So these tend to be the cases, generally speaking, the exceptions, but generally speaking, where we know that the seizures are coming from one particular part of the brain and we can identify that particular part of the brain. So traditionally what's been done is that people have had surgery where essentially the skull's opened up and the neurosurgeon goes in and takes out that particular part of the brain, which is of course invasive and can be risky. But this new treatment has emerged, this laser treatment, where under scan guidance very precisely, this electrode is inserted and passed to that particular part of the brain where the seizures are coming from, and with the laser, that part of the brain is removed. This is a much less invasive and much safer way of tackling and dealing with that part of the brain. So good results are emerging from this. Again, in this region, only Liverpool offer this. But again, if this was something, if you have family or friends who you think this might be of relevance to, then your GP can refer them to the epilepsy clinic in Liverpool, and this can be considered. So the bottom line from that part of the presentation is that if your current treatments aren't working, then do seek help. Do seek help. Speak to your GP. They can refer you to the clinic, and at least there can be a conversation about whether any of those newer therapies could be right for you or for your family. So don't suffer in silence. If your symptoms are not under control, see your GP, get a referral to the neurology clinic, and then the consultation can be had and options can be considered. So that's everything. So please don't forget to give feedback when it comes through on the WhatsApp group. But if there are any questions, then please, or questions from the brothers or from the sisters, then please feel free to ask.
I've just been recently diagnosed. I suffer from juvenile myoclonic epilepsy as well.
Okay, may Allah give you shifa.
Mostly I have my fits in my sleep.
Okay.
And I also got a benign tumor.
Subhanallah. Okay, may Allah give you shifa.
Spine.
Okay.
So it was exciting.
Allah. Okay.
So as you can see, when I get up,
So.
sit down, I make abnormal movements in my arms.
Allah Akbar.
Legs due to that.
Yeah.
When I go to hospital, they transfer me to test in neurology.
Yeah.
You'd be amazed. The waiting list is like 1.5 years just to see neurologists like yourself.
Subhanallah. May Allah give you shifa. It's a difficult situation, and may Allah give you shifa very, very quickly. Are you under a neurologist at the moment?
Yeah, Dr. Majid.
Yeah, I know Dr. Majid, yeah. May Allah give you shifa. This, obviously, we can't, not on the mic, I'm sure you don't want me to go into kind of specifics of your own case, but conditions like this, a situation like this, just have to be handled from generally speaking, from a multi-pronged approach. So this is obviously a complex situation, and it requires a complex treatment where you're getting support from multiple professionals and targeting the problem from multiple ends. So that's one thing. So Dr. Mati is a very, very experienced neurologist, and obviously, he will have the experience to handle this. Obviously, I appreciate there are long waits in the NHS, and that's very frustrating. Unfortunately, we'll make it easy. But yeah. So one thing is that the neurologist will want to bring in a number of teams and specialists to handle a situation like this. The second thing you have to keep in mind that unfortunately things like this tend to be a process. It tends to be a path, and they don't tend to be immediate. There's not something you can do that to immediately take it away. So it does tend to be a bit of a process. But what you need is that guidance and support from those multiple professionals to get you through that. And yeah, I mean, if you want to, I think it's as specifically now or maybe at the end. Feel free to, yeah. Any.
Thank you so much for your talk. There's a lot of people with epilepsy, the laser technology. What is the risk percentage and what complications can it cause?
So the complications will be the usual ones from surgery. So infection, bleeding. Obviously the chances of a neurological deficit developing. So, for example, weakness developing in the limb, or some problem with speech or with memory. But what we're finding is that it is if the cases are chosen carefully, then it's very safe. And we're not really experiencing any problems or any major complications. It's relatively early days in the UK, so there's only 2 centres which have been commissioned by the NHS to provide this. So down in, I think it's in London for down south, but for the north is Liverpool. So just 2 regions, the whole country. So everything in the north comes to Liverpool, everything in the south goes to London. And so it's early days, we're still gaining that data in terms of how it's going to fare. But the signs from other centres internationally is very encouraging, and the signs that we have from the Walton Centre are also very encouraging. So people have had really good results, and we've not really had any complications. Yeah.
So the waiting times are long. Anything from your position, can you help the secondary care to improve the point system?
Yes, GP struggle. Would I be able to change neurologists? So currently I'm with Dr. Majid. So if I, tomorrow example, link the neurologist office up in Preston and say I want to get transferred to the Walton Centre, would that be possible?
Yeah, sure. I think there are 2 related questions. Unfortunately, the waiting lists are long for most departments in the NHS, and that's certainly true for neurology as well. That's across the country. The reason for that is basically a shortage of neurologists. There are not enough neurologists in the UK, so that's the reason why the waiting lists are long. There's just not enough people to see everybody, sadly. In terms of Dr. Azhar's questions about, so Dr. Azhar asked whether something can be done to speed up treatment. The problem of the long waiting is obviously a systematic problem. It's an NHS system problem. So as individuals, it's difficult for us to be able to solve that problem. But the kind of options, as you know, Dr. Nasir, obviously you'll know, but the kind of options that are available are things like the advice line and advice and guidance, and using those sort of sources to get some advice and try to improve treatment while the patient is waiting for the appointment. The neurosciences centres are trying to use specialist nurses and things like that to try and help the waiting list and clinical fellows and stuff like that. But those, again, things that which take time. It's a difficult problem to handle. It's very challenging for GPs, because obviously the patients come to the GP and they're wanting you to do something, but it's not something that's in your hands either. In terms of, sometimes things don't work out with the consultant you're with, and that's natural. The patient-consultant relationship is a natural human person-to-person relationship. Some relationships work out, some relationships don't work out, and that's quite natural. You shouldn't worry so much about that. If the relationship doesn't work out, then there's no harm in asking for a change of consultant. No harm in asking for a second opinion. There's absolutely no harm in that. And sometimes it can be very helpful to do that. It's okay to disagree. It's okay to disagree with the diagnosis with the consultant. If you disagree, if you feel differently, then to get better, it's really important that the patient does accept the diagnosis, whatever the diagnosis is. If the patient doesn't really believe in the diagnosis, doesn't accept it, then even if they got the right treatment, the chances of getting better are low. So that's really important. So if the person doesn't have faith in the diagnosis that's been given, there's no harm in asking for a second opinion or another consultant. And consultants don't mind, because the consultant also wants the patient to get better. And if that means that's going to be through seeing a different consultant, then that's not a problem. What sometimes happens is when things have not gone right, the natural reaction is, it didn't work out, and I don't like the experience I got with consultant X in Preston. I'm going to go to Liverpool, or I'm going to go to Manchester, which is also an option there for the patient. But sometimes what's actually better and more efficient is to say, can I have a different consultant in Preston? And you can just ask the consultant, just ring the consultant secretary and say, I'd like a second opinion. And the consultant would typically just write a referral letter, and get you seen by somebody else. The benefit of that is that all the person's records and scans and investigations will be available in that first hospital. Sadly, the NHS is not linked up. So if somebody has tests in Preston, they're not available in Liverpool, and the tests in Liverpool and notes are not available in Manchester, or vice versa. Okay, those can be requested and those can be obtained, but that again introduces a delay in the process. So what is often better is to change consultant to another one in the same center, if somebody doesn't feel strongly they want to go to a different center, then that can be done as well. Your GP or your consultant, you've got both options. One, your GP or the consultant can write a letter to Liverpool or Salford or wherever, asking them to take over the care. So your closest neuroscience center here is Preston, and the next closest would be Salford, and